Greetings, health practitioners and anyone who's interested in the area of health. I'm Chris and I'm a medical specialist who has practiced for 40 years in almost every area of medicine that you can imagine. The purpose of these podcasts is not to give any advice about your health or treatment. If you have any concerns about your treatment, you should seek advice from your favourite health practitioner. All of these podcasts have been inspired by the book Hippocrasy, written by two medical academics, Professors Buckbinder and Harris, and the book is published by New South Wales Press. Hippocrasy, How Your Doctor is Not Practicing According to His Oath. The title of the book comes from Hippocrates, the Greek physician, and the Hippocratic Oath, which he is alleged to have written but actually didn't write. The focus of the podcast today is on obstetrics, but before I give that, I would like to make a small correction in the previous podcast about blood pressure. In that, I said the American Cardiac Association recommended drug treatment for levels of blood pressure systolic 130 over diastolic 190. The true figure should be 140 over 190. One of the most important journeys that a woman can take in her life is pregnancy and childbirth. The authors of the book Hippocrasy say that this whole process has become excessively medicalised. That is, there's been too much interference of the medical profession and medical science in the process of birth. Associated with that is the fact that birth has come down to whether or not a woman has a caesarean section or doesn't have a caesarean section. In other words, whether she has a surgical birth or doesn't have a surgical birth. Where does the title caesarean come from? It certainly doesn't come from Julius Caesar, the Roman emperor, because his mother was alive when he conquered Britain, and obviously no one would have survived a caesarean section in those times. It's also mentioned in the play Macbeth, where Macduff, who's the man who kills the king, says that he was from his mother's womb, untimely ripped, and therefore the connotation began to develop with caesarean sections that it was a form of unnatural birth. Our authors Buckbinder and Harris, when they talk about the excessive medicalisation of the process of birth, they're talking about a number of things besides caesarean sections. One of these is to do with excessive fetal monitoring, that is, monitoring of the baby before birth. They say because this happens too often, that unnecessarily increases the rate of caesarean section. They also say that episiotomies, that's a surgical procedure that is conducted when the baby's head is about to be crowned and the vagina is cut. They say that this is performed too often as well. There's a difference of some 20 times between those hospitals that perform it a lot and those hospitals that don't perform it very much. In relation to caesarean sections, some women will feel that they're better off having caesarean section or a surgical birth, and they are probably misled about that, because caesarean sections are in fact more dangerous. You require an anaesthetic, there's a greater possibility of infection, and your ability to drive a car and operate machinery after the procedure is considerably delayed. The problem is, as I often allude to in these podcasts, doctors deceive their patients by encouraging them to have caesarean sections when this is not necessary. For example, it almost became law that if you'd had a previous caesarean section or a surgical birth, your next birth had to be a caesarean section. Also, if you had twins, you'd have to have a caesarean section. All this is not correct as the authors demonstrate, and this is to do with the excessive medicalisation of childbirth. In relation to natural childbirth, birth in a maternity ward where there is a birthing suite, the family are present and there's a lot of emotional support, is associated with less need for medical procedures and less need for pain relief. I now come to a very important question. What's the most important thing you should ask your obstetrician before he or she delivers your baby? It's simply this. What is your rate of caesarean section? If he or she won't answer you, or if it's greater than between 25 and 30%, get another obstetrician.